Today's guest is Dr. Stephanie Cohen.
Hello.
How are you? Good to see you, Steph. She is a board-certified plastic surgeon in Maywood, New Jersey, and she's affiliated with Hackensack University Medical Center. She's in practice for more than 20 years. Dr. Cohen did her undergraduate work at Brandeis University in Boston and earned her medical degree from Georgetown University School of Medicine, where she was member of the Alpha Omega Alpha Honor Society. She then went on to complete her general surgery residency at St. Vincent's Hospital in New York City, and she is certified by the American Board of Surgery. In addition to doing her plastic surgery residency at New York Hospital, Cornell Medical Center, and the Memorial Sloan Kettering Cancer Center in New York, where she got her certification by the American Board of Plastic Surgery. She developed a special interest and skill in the area of reconstructive surgery, particularly in the breast. Her dedication to her craft has earned her the nickname of the breast whisperer from her fellow colleagues and patients, and that is absolutely true. I've heard that a number of times. A longtime dream of Dr. Cohen's was to travel to developing countries and provide expert surgical care to those who have had no other possible access to medical care, and this became a reality in 2007 when she became a founding member and vice president of ISMS Operation Kids. Op Kids is a surgical mission dedicated to the treatment of pediatric surgical and medical disorders, and through yearly missions to places such as Kenya, Egypt, Peru, and others, Dr. Cohen has operated on hundreds of children with disorders ranging from cleft lip and palate to debilitating burns. Dr. Cohen's website is cohenwintersplasticsurgery.com, and she's located at 113 West Essex Street in Maywood, New Jersey, 07607, and their office phone number is 201-487-3400. So welcome, Stephanie. How are you?
Thank you, Sam. Good. It's nice to talk to you. Thanks for doing this.
Yes, we see each other at meetings, now more virtually than anything else, at Hackensack. And I just wanted to have other people learn more about you. And I also wanted to learn more about you. I think there's a lot of awesome plastic surgeons in Northern New Jersey, and I certainly think you are one of them for sure.
Well, thank you very much.
And I would like to first start, because we all have interesting origin stories, more or less, I think. And I wanted to hear how you started on your plastic surgery career and what brought you into it.
Sure. So I was sort of born to be a surgeon. I don't think I had another choice. My father was an obstetrician gynecologist, and I was the firstborn. I was supposed to be a boy, and it didn't happen. He from the time I was in the crib, used to say, "Surgery is such a great career for a woman. Surgery is such a great career for a woman." And I didn't realize that he was lying until I went to medical school. So. It's what I heard for a very long time, and I really was originally very artistic when I was a kid, and I thought in high school that I was going to go to art school and not go to a regular undergraduate college. And I had some art classes with an art teacher in my high school that I got very close to, and she knew I had a talent for science and a father that was very interested in me going to medical school. And she said to me, you can always be an artistic doctor. You can't really do it the other way around. So she said she encouraged me to go to college and to take it from there, because I could always become an artist if I wanted to. But if I had given up the idea of going to a regular academic college and then medical school, she knew that there was really not any turning back from that. And so obviously, by the time I got to college and did my pre-med and then decided I did want to go to medical school, the art was sort of the perfect segue into ending up in plastic surgery. The plastic surgery piece was really, I can definitely pinpoint Dr. Paul Tessier, who was very famous craniofacial surgeon way back when. And I can actually remember being about 12 years old and watching something on TV where there was a video of Tessier performing a hypertelorism surgery and bicoronal incision, and they had peeled the face down, and everybody in the room behind me had gotten up and ran out of the room. And I thought it was the coolest thing I ever saw. And I really never changed my mind about that. When I went to medical school, I always knew that when I went to medical school, it was going to be to do a surgical subspecialty. I was going to do something with my hands because I'd always been very handy and very artistic. And if it wasn't medical school, it was probably going to be architecture school. I was going to do something physical. And so the idea of being a pediatrician or being a radiologist, it was just never that was never going to happen for me. So I always wanted to do something, use the knowledge that I had, science and anatomy, and use my hands to do something. I've always been very technically, adept at things when I tried them. So going into surgery was the natural course of that. I went, when you and I did our general surgery residencies back then, everybody did general surgery residency. You didn't go directly into plastic surgery. I don't want to date you or anything, but I'm dating myself, and that's fine. So back then, everyone went through 5 years of general surgery. We all became, at least board eligible, board certified in general surgery before we chose what we were going to do with our specialties following that. And when I went, I did go into general surgery with an open mind that I was going to look at all the different subspecialties and see what I like. And when I had been in medical school, I had done a rotation in the Children's Hospital of Washington, D.C. When I was at Georgetown. It was very heavy craniofacial oriented. And I had an attending there. His name was Michael Boyajian, and he was the craniofacial surgeon there. And another moment in my life where I spent a month doing that, and I said, "Oh, this is what I want to do. I could do this for forever." And then I went and did my general surgery residency, and a lot of years went by because general surgery takes a really long time. And by the time fourth year came around, when I had to apply for plastic surgery again, I said, let me just make sure this is really what I want to do. So I went and actually spent a month of my vacation back down in Washington, D.C. at Children's Hospital, kind of unofficially rotating with Dr. Boyajian again, just to make sure that that was really what I love to do. Ironic, because this is not really what I do for the most part of my practice, but I did love it as much as I had the first time, and then went and finished all the things you have to do in order to get into plastic surgery. Was lucky enough to match at Cornell and New York Hospital, which was a wonderful place to train, and interestingly enough was very hands-on, very clinical, just like my general surgery residency at St. Vincent's had been. And, interestingly, while I was there, Cornell did not have a very strong tendency towards craniofacial. But we did do a lot of cancer reconstruction, and we did spend a lot of time at Memorial Sloan Kettering. And so when I was there, I was learning a lot about microsurgery and learning a lot about breast reconstruction and breast cancer, and sort of headed in that direction. But I would always go back and spend a little bit of time doing craniofacial at any chance that I had. In order to be a craniofacial surgeon, as you know, you need to have a fellowship in craniofacial surgery. And I had 2 little kids at that time, and a husband who had just started in his practice, and 7 years of residency under my belt, not to mention 4 years of medical school. And my husband said, "If you do another year of school, I'm going to divorce you." And so at that time, it was a little bit impractical to consider applying to places all over the country and going wherever it took to get a craniofacial fellowship. So I took the plunge and went into the plastic surgery practice, and started doing what I knew how to do very well, which was a lot of complex reconstruction and breast cancer after reconstruction. And it kind of got honed over the first few years, whereas my partner was more interested in doing chest reconstruction and extremity reconstruction, that it sort of naturally fell to me to do the breast reconstruction. And so I kept on in that mode. Part of the reason why, and I know we're going to get to this, but part of the reason why I ended up starting this medical mission trip was really, again, to get back to my roots of loving craniofacial surgery and really being able to do a little bit of that, because that really brings the artistic side into it as well.
I want to, before we get into your career after training, I wanted to ask you a couple of questions about your training, listening to it. The first is, I am familiar. Is St. Vincent still in existence?
St. Vincent's is a bunch of condos right now, which is really sad.
Right.
The hospital went under.
Yeah, and I remember I did interview there, and they were very busy. I think that the case numbers that the residents quoted when they were there were higher than almost any residency program. But I also remember them as not being so plastic surgery friendly. I felt this distinct, if you're going to come here to do plastic surgery, that might not be the best place for you.
You have a very good memory from a long time ago, because that was absolutely the chairman's desire was that no general surgery trained resident would go into plastic surgery, and it sort of became the program that was known for that. Like, don't come here and end up doing plastic surgery. And it was interesting because when I when I applied to my general surgery residency there, I had told them that, one of my interests was plastic surgery, that I hadn't decided that. I had a whole bunch of things I loved. I loved trauma. I loved pediatric surgery. I loved oncologic surgery. I guess I could have always ended up a breast surgeon instead of a breast reconstructive surgeon. Obviously I got my categorical spot there, and once I started as a resident there were six residents in each year when I was there. We started off at 5, we ended up at 6, and of all the residents that were in every year, I think in my year 3 of us or 4 of us ended up going into plastic surgery. And it went much smoother for me than it did for my fellow residents, because I was straight with my chairman from the day I got there. I said, listen, I am going to learn general surgery. I know one of the major problems that the general surgery chiefs had with people going into plastic surgery was you trained, I understand it, you trained for 5 years to be a general surgeon, and then you sort of quote unquote waste your training, which, we could get into that as a whole other podcast of how much better it is to have general surgery under your belt before you train to be a plastic surgeon, but different topic. But at any rate, I was straight with my chairman from the time that we started, and he always knew that I was thinking about doing it. So that when I did, and I promised him when I graduated, I'd take my general surgery boards and I would pass them. And his concern was that a lot of people who went into plastic surgery ended up saying, what do I need the general surgery boards for? Mm-hmm. And that goes on his stats. If he graduates 6 general surgeons and only 3 of them take their boards, right, then that doesn't look good for him. So right, it's a philosophic and also a bit of a, just a kind of logistical thing. But I said to him all along, I said, look, this is what I'm interested in. I'll let you know in another year or 2 whether that's what I want to do. And I was straight with him from the very beginning. Everybody else in my program didn't tell him they were terrified. They didn't tell him until they were 4th or 5th year residents and they were applying. As you know, you apply in your 4th year residency. Right. And they didn't tell him until they were applying, and he got very, very angry. And they all asked me, how come that he didn't get angry at you? I said, because I told him 4 years ago that this is where I was headed. You got to be straight with people, So that's kind of how that's kind of how that happened. And that's how I got to Cornell as well, because, the New York City scene, everybody knew everybody. And right, I had looked at Columbia and looked at Cornell and was very, very interested in staying in the New York area. My husband was at Columbia, and he's a doctor as well. He's a child psychiatrist. And so we wanted to stay there, and that's how that happened as well.
Back then also, the work hours were pretty horrific, and the work environment has really changed, especially for women. There's no doubt. It's gotten,
Yes.
it's changed over the years. And I remember so much, well, I always felt like there was bullying in general in surgery. They bullied you for whatever weakness you showed, or whatever characteristic. If you were really short, if your skin color was different, if you happened
Redhead.
to be redhead, they just, whatever they could find, they would pick at it, because it was, for many people, a pretty miserable experience, and misery loves company, and they would always try to, and let's face it, a lot of it was very male. It was male dominated. There were very few women attendings. There were very few women. I don't even think there were any women chairmen at the time, that I can remember. And I saw that with my colleagues. How did you manage that, and what were your experiences like?
So I have a couple of interesting anecdotes about that, of course. Again, the original anecdote of my father telling me that surgery was a great career for a woman, and me realizing that he was lying. I started off at Georgetown in medical school, and Georgetown was very surgically oriented. I think a larger number of residents from medical students from Georgetown go into surgery than almost any other specialty. So it's very surgically oriented. We did a lot of surgery in our medical school training. I knew that's where I was headed. They were also very misogynistic at Georgetown. It was very male and very military, and very, it was very, very helpful to be tall and masculine, and that was certainly things that were helpful in getting to be known and getting them to write you good recommendations. I had an attending. No, she was a resident. I'm sorry, she was a resident in general surgery when I was rotating as a medical school at Georgetown, and she was a general surgery resident. She was either a second year or a third year. She seemed incredibly old to me at the time. And she said, if you can find anything else you like half as much, do that. I couldn't find anything else I liked half as much. So I knew that I was headed that direction. I looked around, and you alluded to it before. There weren't any mentors for women back then. Even if there were some women in general surgery, I didn't know any women in plastic surgery. But even if there were women there, when I say mentor, I mean somebody I might want to hang out with. So either they had gotten there and they were mean and nasty, or they had gotten there and they were single and not married and no children. And so I looked around and thought, gee, there's just really nobody who has done this. It's hard to say where, at what point you say to yourself, well, all right, I'm going to do it anyway. Or I can do it, and I can do it differently than other people. I had one of the men who ran the operating room in my general surgery program. When I first got there, he was the guy who sits at the front desk, and everybody gets to know him, and he gives you your schedule and everything. And he said to me, "You're too nice. You're never going to end up this nice when you graduate from your general surgery residency." And I said, "No, I'm gonna." And he said, "No, you're not gonna. You're not gonna be this nice." He says, "I've seen it 100 times before. You're gonna come in. You're super nice. You talk to people. You don't look down on people. By the time you graduate, you're gonna be a real pain in the ass." And I bet him dinner that I would graduate the same way that I came, and he bought me dinner when I graduated, because it's just, they call me the Teflon Queen when I was in residency. I have always had a pretty good sense of self. And I'm not the best. I'm not the smartest in the room, but I know what I want to get done, and I'm a perfectionist, and I want to get it done right, and I want to know it, and that's for myself. It's not for anybody else, So there was a lot of that. There's a lot of sort of military, you're terrible in the ICU. You're awful. You're the worst resident we've ever had. And I was just like, okay, whatever. And that's just some somebody venting to you that day because they're upset about something, or they're not happy. One thing that I always could fall back on was, technically, I always was very confident person. So again, back to that whole, I knew I had to do something physical with my hands. When I got into the operating room, most of the time there was nobody in the room who could do it better than I could. So I was never unconfident about that. And when you are that way about, yourself, and I'm a really not comfortable toting my own horn. But that was just something that was always so obvious, that that never, once you're confident in that you can do it, what everybody else around you might say or do doesn't really matter all that much.
That is unusual, because I think you're right. You have to have a lot of intrinsic Teflon-esque qualities about you.
Yeah, Teflon Queen. That was my title.
And also, you unfortunately, a lot of people who are in the same situation, a lot of women feel like they were better than many of their peers around them. And that's the only thing that sort of sustained them, was that they knew that, and that was able to keep their confidence up and sort of maintain their spirits, even though they knew there was a lot of crap flying their way about stuff.
Yeah, my husband and I have a joke that, and I mean, it's a joke for us now. We've been married 30 years, but we both went to Georgetown together, and we actually met each other in medical school. In our first year of medical school, started dating right in the middle of our first year of medical school, and got married a week after we graduated from the school. But we did our general surgery rotation together as third year medical students, and the chairman of urology, we had a rotation with him, and he was a real hard ass. And the general surgeons at Georgetown were like the real good old, Southern good old boy kind of cowboy boots, and that's the way that they were. And the chairman of the department would have a didactic session with the medical students, and there was a lot of direct questioning, and you had to get the question right. And my husband's joke, which was it's not so much of a joke because it was really very, very accurate, was my husband ended up a psychiatrist, but he was very interested in the surgery and the excitement of surgery and the intensity of surgery, and he was very interested. He was very good at it, and they would during these educational sessions they would say, Peter, can you explain to me what that big organ in the middle of the chest is? And it goes lub-dub. What is that? And he'd go, the heart. And they'd go, great, brilliant. And they'd say, Stephanie. And I'd be like, what? And they'd say, I'm a red blood cell in the superior mesenteric artery. Get me to the,
Right.
Go. And I go. And I get, 3/4 of the way to where they wanted me to go. And they go, okay, time's up. You didn't make it. And that was seriously the way that
you saw the deck was stacked.
It had to be. Seriously the way it had to be.
That's awesome.
You just had to kind of turn. It is what it is. And I'm sure that as more and more, women do more and more, lots of different kind of career paths, there are certainly still some that are out there like that. Surgery has certainly come a long way since then.
Absolutely.
And so again, again, you just had to kind of shut your head to it because you knew what it was about. It wasn't about your ability or your intelligence. Right. It was really more just about, what people's own entrenched ideas about who should be a surgeon. And most of the time until they operated with me, and I had attendings in general surgery where, I would move their hand out of the way when something wasn't happening the right way, and I would, get the stitch or do the thing. Mm-hmm. And there were, lots of trauma surgeons and times when, we'd walk out of the room and they'd be like, yeah, okay, thanks. It's just an under the table kind of thing where it doesn't have to be acknowledged. It just is, that's just the way it is. And so, I
think the one thing about surgery, and especially back then, because we had so much more latitude and responsibility, especially as senior surgeons, that
Sure.
talent did rise to the top. They knew who were
Right.
good and who were not
Right.
good, who they could trust and not trust. And regardless of what prejudices they had, if you were good in the OR, that's what hopefully mattered the most for most senior surgeons, I would think. So that was the one saving grace about surgery, I would say, for sure.
Absolutely.
When you were at Cornell, who were your mentors? Who do you think influenced you when you were training in plastic surgery there?
Oh, well, Lloyd Hoffman, who I do believe you interviewed at some point on this show, and Dr. Lloyd Gale was really, sort of fast and hard second. We also used to rotate at Sloan Kettering, where I worked, very closely with David Hidalgo and Joe Disa. Joe Disa was a fellow at the time. And he was a fellow the first year that I was there, and then became the first year attending the second year that I was there, and Peter Cordero, of course. So,
do you have any best or worst moments that you remember from your residency? Oh shit moments, or oh my, or that was awesome. That was fantastic.
Goodness. Oh my goodness. Wow. That's a good question. I'm sure that, those stories come up when you're operating all the time,
I know.
And you start telling stories and you have like these great, moments where you think of something that happened and you're like, oh, wow, that was, that was really great. And then there are those, and then, the bad ones. I have my favorite Lloyd Hoffman story, who I have so many lines that I still say from Lloyd Hoffman, all complications go away eventually, have patience. There's so many things that I take from the way that he did things. And he was he has such a demeanor about him that was just so calming, and didn't usually get hysterical. And, when you go from the general surgery residency to the plastic surgery residency, you're ready to go into practice. You've done 5 years of general surgery, and everybody else around you is going into general surgery. They're like getting practices and getting paid, and, all kinds of, you're ready to go. And in your own self, you've got a lot of confidence at that point. You've been a general surgery chief resident, and you're ready to go. And then the way we did it was, then you went into plastic surgery residency, where you almost started like an intern again. And it was a very, very difficult moment for me, in my career of training. I had just had my second child, and so I was a little bit postpartum. And I got to residency, and I was like, I hate this. I don't know anything, and I should know everything, And I felt very unconfident at that moment in time. And I had started my my first plastic surgery rotation at Sloan Kettering, so I hadn't been at Cornell when we first started. So it was, maybe 6 months into my career at Cornell that I was finally rotating through the main hospital and meeting Lloyd Gale and Lloyd Hoffman. And I was doing a tissue expander exchange to permanent implant with Lloyd Hoffman. And it was my first time I had operated with him. And he was having me close the muscle layer, and as he was saying, don't put the needle through the implant, I put the needle through the implant. And it's the only time in my entire career I have ever popped an implant with my own two hands. And he started jumping around in the operating room and saying, oh, that was the one thing I said not to do, because we had just gotten the new implant in there. It was probably the only one we had in the operating room. It was terrible. And I thought, oh my God, he's going to think I'm the worst person on the planet, and I'm horrible. And about a full year later, I was a second year resident, and was coming to the end of residency, and they were looking at the new applicants for the year after. And Lloyd had called me up, and he had been asking me about a resident that had applied that was at St. Vincent's Hospital and was coming, and obviously had come through the same path that I had, and wanted to ask me what I knew about the resident. And I'll never forget this, because he said, is that resident as good as you?
Oh,
And I literally felt like I was about to burst into tears, and just that it changed everything. I just couldn't believe that he thought that I was good at what I did. So it was that was a big turnaround. So that qualifies as worst and best
absolutely. That's so
things that have
funny.
happened in the operating room.
It's funny. Early in my training, I did exactly the same thing. I was closing an implant on a breast dog and nicked it with the needle. And it was awful. And we do live through, our mentors do live through us, because every implant closure I do, at least for a second, or probably for many seconds, I think about that. And
Oh yeah.
I will always remember it. That will always be burned in my brain as well. So, and
Oh
everything
yeah.
you quote with your mentors, everything you say, they live through us, which is
Yeah.
fitting, I think, in many ways.